used for people who support medical choice, autonomy, and the notion that the government should not be involved in people's lives when they are making decisions for themselves. A U.S. federal judge has now blocked the ban of Florida's decision to not allow for transgender care when it comes to things such as puberty blockers and gender-affirming hormones. So let's talk about it. Hey everybody, it's Dr. David, a board-certified pediatrician in Tampa, Florida. My practice is holistic pediatrics and family care. I have devoted my career to supporting the life of families making the decisions that they think is in the best interest of their child, even if it may be against what mainstream would necessarily believe that people should do, but also that the government should not be involved in those types of decisions. This should be something that is relative to what a physician or other medical provider, a parent, if it's in the case of a child, and of course, a child who's involved in these types of decisions should be able to make without, again, the government intervening. There should not be that type of regulation, in my opinion. Now, medical choice for me is not just relative to gender-affirming care, as I've talked about many times. That's true for vaccine choice. That's true for reproductive health, and also just how to really support the child who may be questioning their gender. Okay, so it doesn't necessarily mean that they're wanting to go forward with actually transitioning. So this is not necessarily just the support of people who identify as transgender, but this is a process along the way. Okay, now if you're not familiar with a lot of the terms, I would suggest that you go back and see the video. We'll put it down in the show description. That was called the ABCs of LGBTQ. That kind of explains some of these different differences, but I'm not going to get into that now. Okay. Now, before I do dive into the material for today, I would like to ask you that if you do like what you're hearing, please subscribe, please share with others, please become a supporter of ours on Patreon, where you can get access to the videos early, as well as many educational materials that we have that I would normally have just for my patients. Okay. So now let's first talk just about the original law that passed in 2023. This was a bill that Governor DeSantis of Florida signed. What it did is it banned gender-affirming care for minors, even though it was a medically appropriate decision as made by a physician and by a doctor and a group and therapists and counselors and many other people as well. And it actually also not just banning that, it created a felony, criminal, and civil penalties for medical providers who provided those types of treatments for people. So, of course, that made many of us no longer willing to do that because we don't want to risk our medical license or incarceration. Now, there were some kids who were undergoing gender-affirming care, but if they were doing that prior to that new law going into place, they were allowed to continue. So they weren't forced to withdraw. But also for adults and a few minors, it also meant that that they changed it so that nurse practitioners and other healthcare providers who can prescribe were not allowed to be the order to order. Had to be a physician. It barred telehealth, which is something that we're allowed to do in every other aspect of medical care, and it can be a hindrance for people to have to go physically, especially if there's not many providers around and they would have to travel long distances. It also required patients and families to sign informed consent forms that were not medically accurate and in fact contain homophobic type of language. And the thing is this, the patients were already signing informed consent forms because that's what we do whenever we do a medical care. We, of course, have to get informed consent whenever we're doing any type of procedure. So that was an unnecessary thing that was just one more barrier and could potentially make people feel bad if there was this homophobic type of language that was in there. Now, what did this federal judge do? Okay, so his name is Judge Robert L. Hinkle, and he flat out banned that he said that the banning of transgender care when it's medically appropriate, he declared it's unconstitutional. It's against the U.S. Constitution, which I would hope we would all believe that we all believe in what the Constitution says. Okay, it did say that Florida can regulate the treatments themselves, but they can't ban it. They also said that you can't deny transgender individuals safe and effective medical treatment just because they're transgender, which is what this law was doing. And then also, a lot of the treatments that are available to be used are available to cisgender people who identify with the sex that they were born to, but have other medical reasons for using those exact same treatments. So that's where the discrimination became, because there are legal treatments in other situations. Okay, now this is what Judge Hinkle actually quoted, and I want to make sure I get it right. So, he said that DeSantis and the House representatives who passed this, claiming that young children were being castrated or sterilized because of medical treatments for dysphoria. And the state said that, and then admitted there was no factual basis whatsoever. They were just blowing smoke. There is no evidence that these were castrations, medical castrations. These were treatments being needed because a person had gender dysphoria. And for those who don't know, gender dysphoria is severe anxiety, severe depression, potentially suicidal, because a person is not allowed to be who they feel that they are. Okay? Now, then the judge went on to say, transgender opponents are, of course, free to hold their beliefs, but they're not free to discriminate against transgender individuals just for being transgender. And that's quoted from the paper that was released by the judge. As you might imagine, Governor DeSantis says that he is going to appeal this. So, of course, we'll see how that goes. But, of course, for now, this is the law. So where does it leave things? Okay. So first of all, in terms of just a review for what transgender care is. So first of all, as I've talked about before in other videos, part of transgender care and support can just be supportive of somebody, being there to give unconditional love, to respect other people regardless of their decisions, and not to be homophobic, not to be bigoted just because a person is who they are. It's just, and some people, that's just enough. They just need to know that they're cared for, that they are not being discriminated against. Okay. Now, some people can be just social transition, how they dress, how they hold their hair, what they choose to do in terms of wearing or not wearing makeup. And that could be, again, something that's all people may need. Okay. Of course, there has to be age appropriate mental health counseling. So when a person who undergoes, before they undergo any of these hormonal types of treatments, they are assessed up and down by mental health therapists, counselors, and it's not only because to make sure that this is the right decision, but usually because you have the dysphoria, you have a mental health condition. You have symptoms that can be very, very concerning. Okay, but also, what does this do? It places the decision back in the hands of parents, in doctors, and for the adults who are caught up in some of those bans, and the patient itself, right? Or for the minor, who are, of course, part of those decisions. Now, minors with gender dysphoria, of course, as I said, they undergo this extensive kind of therapy, counseling, discussions, etc. And then the first thing that's usually done are puberty blockers. And sometimes that's all that's done. And what that's basically doing, because once we know secondary characteristics, whether it's facial hair, Adam's apple, growth of breasts, if that's not what a person wants, a puberty blocker is used just to stop that from progressing. But it actually has nothing to do with with reversing things. If a person stops a puberty blocker, then their puberty will then proceed. Okay. Then after that, they're what are called gender affirming hormones. So of course, if an individual associates with and wishes to transition, if they were born biologically as a female, but as a man, then they would take more testosterone types of hormones. And of course, if it was the other way around, then estrogen types of hormones would be used to develop those secondary characteristics. Now, in terms of adults, adults can get treatments from other qualified medical providers like nurse practitioners, etc., who have the ability to prescribe, which we had before. And they are also allowed to use telehealth, which is nice because, again, for the reasons I said. So in terms of my take on all of this. So first of all, I think that this is a very positive move for people who support medical choice, and that the government should not be involved in any of these types of decisions. I firmly believe that that's autonomy. That's what it's all about. Now, it does concern me a little bit that the state can regulate the care, even though they're allowed, because, the feds already do that. All right, they already do regulations of those things. So I have a concern that the feds can say, yeah, they're legal, but we're only going to give allow for 1% of the therapeutic dose. And of course, that would then get caught up in litigation as well, because of course, then that's not a medical treatment, and it would again be kind of considered a way of discrimination. So we'll kind of see how it does, but they can certainly try to gum up the workings, if you will. Now, so it'll be interesting to see what else could they come up with. I don't know. Okay. Now, Judge Hinkle went on, and in my opinion, he summed it up perfectly. So I'm going to end with quoting him. Some transgender opponents invoke religion to support their position, just as some once invoked religion to support their racism or misogyny. So, we know that things change over time. Okay, but then he went on to paraphrase Dr. Martin Luther King Jr. By saying, the arc of the moral universe is long, but it bends towards justice." And let's certainly hope that as we go through appeals, that's what happens. All right, so you have my take on this now. I think it's an important thing that this passed, and hopefully this will set a trend that people won't be discriminated against, that people will be able to get the types of medical care that they want, whether it's for gender affirming care, whether it's for reproductive rights, whether that's for vaccines and how they choose to proceed. Have a nice day.